And now let us move on to the third session of the day, that is session on cardiology in Ayurveda. For this, now I welcome our distinguished guest speaker of the day, that is Professor Dr. Sambamurthy G.G. sir, who has got vast experience in the field of cardiology and its effective management through Ayurveda. I welcome sir onto the stage. Dr. Sambamurthy was born on 19th June 1964 at Kumta, Karnataka, and he did his post-graduation from Government Ayurveda College, Bangalore in the year 1994. He was the principal of Mahaganapati Ayurveda Medical College, Dharwad, Karnataka, and he was also the principal of Dhanvantri Ayurveda Medical College, Siddhapur, Karnataka. He is a student of distinguished Ayurveda stalwart Dr. C.S. Somaya Ji. He is the editor of Ayurvignan published by Ayurveda Academy, Bangalore. He is also Vice President of Ayurveda Academy, Bangalore. Since 25 years, he is practicing Ayurveda at Samiksha Ayurvedalaya, Sirsi and Bangalore. Now I request Dr. L. Venkataratnakar, Professor and Head, Department of Kaumarabhutyam, to honor our guest speaker, Dr. Sambamurthy sir.
Shri Gurubhyo Namaha. Harihi Om. Namasabhabhyas Sabhapatibhyascha. Sumadhyanam to all of you. You have taken good meals. I don't think you will sleep in my seminar. Management of HRIDROGA, CAD and Ayurveda, a clinical experiences of a Vaidya, that's me. I am going to share with you. हृदये मूर्ध्नि बस्तौ च नृणां प्राणाः प्रतिष्ठिताः तस्मात् तेषां सदा यत्नं कुर्वीत परिपालने आबाधवर्जनं नित्यं स्वस्थवृत्तानुवर्तनम् उत्पन्नार्तिविघातश्च यथोक्तं मर्म परिपालनम्. When you consider Hridaya, usually a patient suffering from HRIDROGA comes to a clinic of an Ayurveda practitioner. Usually general tradition is there that we can't treat HRIDROGA, there may be complications, please go to a modern doctor. That's the general tendency. But actually speaking, if we go to the Shastra, if we actually try to understand what is it HRIDROGA explained in Ayurveda, we will come to understand actually the 90% cases who are named as suffering from HRIDROGA, that too coronary artery diseases CAD, they are actually easily curable medicinally. Not only by medicines, even by only we can treat them and cure them. That is the truth for which we are going for surgery, not once, many times, twice or thrice, till the lifespan of the person reduces. Harate hriyate va. Harati, that is harati, hriyate va. One is actually, that is written wrong, not harate, harati hriyate va. One is in Parasmai Pada, second one is Atmane Pada. Harati means it gives away. Hriyate, it receives. That is told in other words, Hru aharane do dane ya gatau. It receives not only rasa and rakta, but also the thought, the indriyarthas, because Indriya, Indriyartha, Mana, Atma, Buddhi, everything resides in Hridaya. Hridaya has been explained. Pundarikena sadrisham hridayam syad adhomukham jagratastad vikasati swapatascha nimilati. That means what? When you are awake, it blossoms. When you are into sleep, it closes down. Really, will it close us down? No. Swapatascha nimilati means the activities of indriya and indriyartha, the manasika chesta actions will get reduced. That is one point. Secondly, even the heartbeat get reduces. When you are into a deep sleep, number of heartbeats are reduced. When you are in a severe activity, heartbeats are more. That's why it is that swapatascha nimilati jagratastad vikasati. Actually, yogis, when they perform the Ashtanga yoga systematically after doing yama, niyama, etc., in the samadhi sthiti, they are able to completely stop the heart function for few minutes, sometimes few hours, because the indriya, mana, indriyarthas are into a complete nil state, no action is there, that's why no heart function is required, but patient will never die. This can be exhibited. That's why Hridaya means for us, it is not just a pumping station. Hridaya is all. As it has been told, Shadangamanga Vijnanam, Indriyani Arthapanchakam, Atma cha Sagunas Chetas Chintyancha Hridisam Shritam. All these are situated in Hridaya. If there is an Abhigata to Hridaya, patient dies. If there is an Abhigata to any other part, there cannot be death, but there will be complication, other complication, but Hridaya is so vital. As I have discussed with one of the very famous dean of modern medical college, who was treating heart diseases, I explained about our research in HRIDROGA. I discussed with him. He told, it is true, heart should not be touched by any seizure, any surgery. The lifespan of the person comes down. Heart diseases always should be managed by medicine and food. That's why the research which you are doing in Ayurveda is wonderful. Continue, he said. That's why I say the knowledge of Hridroga Chikitsa, the Nidana and Chikitsa that is given in Ayurveda Granthas is really vast, wonderful and complete. See, the Hridaya is also a Moola of Rasavaha and Pranavaha Srotas. It is a seat of Vyana and Prana, Avalambaka Kapha, Sadhaka Pitta. As Charaka says in Siddhisthana, Vyana Apano Tadashritam. Because when Apana gets vitiated, then there is reflection in Hridaya. In number of Vegavarodha conditions, if you go through, among 13 Sharirika Vegas, in about 10 Sharirika Vega Dharana, it is said that that will lead to a Hridroga. That's why, and also Hridaya is the seat of Paravojasthana, the Ashtabindu Pramana Paravojasthana. That's what actually found in a man in Hridaya. That will not go through, will not compare, but this is the seat of everything, this is the center of life. That we have to remember. So what is Hridroga? Hridaya we have understood. In short, that is not all. Another point I wanted to discuss with you. See, while the formation of Hridaya is discussed in the 4th chapter of Sushruta Sharira, he says, Shonita Kapha Prasadajam Hridayam. While he says, in the formation of other organs, he says, Prasadat. Shonita Medaka Prasadat Urkau, he says. There, Prasadat means that is in the Apadana Karaka. Why I am explaining all these things to you? If we want to decode the text properly and understand the real hidden meaning in those shlokas, then we have to understand the Samskrita Vyakarana properly. If you understand Vyakarana properly, we can understand the real meaning in it. See, when you say prasadat. When you say prasadajam means here prathama vibhakti is used, prasadat there apadana karaka, panchami vibhakti is used. Apadane dhruvam apaye apadanam. There the moola dhatu, moola dosha by which the organ is formed no longer continues. That's why healing the organ when it is at the time of difficulty is difficult, whereas Hridaya is concerned within 3 minutes of a heart attack by collaterals, complete blood circulation is reassured by Hridaya. That is the importance of cardiac muscles are concerned. Because Shonita Kapha Prasadajam Hridayam, Shonita and Kapha-janya, the formation of tissues is continuously going on. Easily the functions of the heart can be normalized. That's why nobody will die out of Hridroga suddenly without having the end of life. That means what is the purpose of each person is there when we are born. Until the purpose is reached, Hridaya will not stop beating. That's why Hridaya, because it is the center of life, maximum care has been taken by Lord Brahma, that it is supported by many things. It will not go easily stop. Okay. So let us go to Hridroga. Sushruta is explained, Dushayitva rasam doshaha viguna hridayam gataha hridi badham prakurvanti hridrogam tam prachakshate. Here rasam doshaha dushayitva hridayam gataha vigunaha doshaha rasam dushayitva hridayam gataha hridi badham prakurvanti. Hridi badham, badhra vilodane, mathana iva, the pain will be cruciating pain. Badhra dukkhe nishedhecha, sometimes it may lead to death. Dukkhe, it may create long-term problems when Hridaya is involved. That's why Badha Shabda Sushruta clearly has used. And Vagbhata very intelligently has given Hridroga Nidana in Rajayakshma Nidana. And there he says, Tesham Gulma Nidanoktai Samutthanaischa Sambhavaha. Samuthanaihi cha. Here very important. See, concentrate. He has given the Hridroga Nidana in Rajayakshma Nidana and says, Tesham Gulma Nidanoktai Samutthanaischa Sambhavaha. That means he understand the technique involved in the study of the Vedic sciences anywhere. As Charaka says at the in the Sutrasthana 30th chapter, he says it has to be studied like this: Tantra Tantrartha, Sthana Sthanartha, then Vakya Adhyaya Adhyayartha, Vakya Vakyartha, Shabda Shabdartha, Prakarana Prakaranartha. We have to understand. While giving this particular Hridroga Nidana in Rajayakshma Nidana, Vagbhata clearly says, due to Rajayakshma Samprapti, Hridroga will be there. But while telling that, he says, Tesham Gulma Nidanoktaischa Samuthanaischa Sambhava. Samuthana, Utthana, Udgamanado. Samuthana, Samyak Udgamanado. That means complete Samprapti is also possible due to Gulma Nidana, he has explained. It is something surprising, isn't it? He told that he told it in the Rajayakshma Samprapti and says it is due to Gulma Nidanokta. It may also be caused due to Gulma Nidana. That means Hridroga can be caused by two ways. One is due to Rajayakshma Samprapti, secondly due to Gulma Samprapti. That we can understand. That we'll discuss how it is, we will go through. In Charaka, he has explained this chapter in Trimarmiya Adhyaya. Two chapters are there. Trimarmiya Siddhi is there. There also he has discussed a few things. And in Trimarmiya Chikitsa he has explained, he says, Marmani Bastim Hridayam Shirascha Pradhana Bhuta Vadanti Pranashrayani etani hi pidayanto vatadayo asunapi pidayante Tatsamashritanam anupalanartham mahagadanam shrunu saumya raksham. That means here, while explaining Charaka, he concentrates on Pranavaha Sroto Dushti Pradhana Hridroga. He explains. He says, it's a Pranavaha Sroto Mula. If there is any Hridroga caused by the Nidana, then it is very difficult to get cured. Sometimes the patient may die. He warns over here. Okay. Now the present topic is CAD, coronary artery diseases. It is said that about maximum number of cases that you die due to heart diseases, more than 80% of them are due to coronary artery diseases. That too nowadays, not only poor people, not only rich people, but poor people are also getting affected with the CAD, coronary artery diseases. And among 10 in 1 are suffering from coronary artery diseases is the recent research that what they say. That means we are exposing ourselves to either Pranavaha Sroto Dushti Karana or Rajakshma Samprapti Karana to get Hridroga, or we are getting exposed to Gulma Nidanokta Hridroga Samprapti. Study says surgery, angioplasty, they sometimes remove the obstruction, but they are risky and costly, and often CAD reoccurs. Angiogram itself, it is said that it is risky. In severe conditions, patient may die on the table during investigation. There is no oral medicine. In modern medicine, they will go for surgery. Present study, that's why it proves the efficacy of the classical text in complete removal of the plagues by just oral medicine. Hridroga is classified into 5 main types based on Vataja Hridroga, that is degenerative origin, Pittaja Hridroga, Kafaja Hridroga, Sannipataja and Krimija Hridroga. See, wonderfully, in Vataja Hridroga, all the lakshanas which we find in the clinical practice are completely explained by Brihatraikaras. Ayamyate marutaje hridrogam tudyate tatha. Ayamyate marutaje, there is the radiation of pain. Dirghi kriyata, Sushruta says, Dallana says, Dirghi kriyata iva, pain starts from here, it spreads to the left hand. And all types of cruciating pain, cutting pain, different types of churning type of pains, all types of pains and sufferings are explained by Brihatraikaras. Especially Vagbhata gives a complete details. Even Shwasarodha, Bhayaha, Shokaha, Shabda, Sahishnuta with the patient experiences has been clearly explained by Vagbhata. In Pittaja Hridrogas, the simple conditions which we find is along with Svedana, Chardhanam Chamla Pittasya, there is vomiting sometimes. In severe ischemic heart disease conditions, if it is Pitta Pradhana, you will find that symptom. Pain is also there, there is vomiting is there, sweating is there, Brahma is there, Kampa is there. All these lakshanas are found in Pittaja Hridroga conditions. In Kafaja Hridroga's conditions, there is a specific lakshana Vagbhata says by which you can identify that this is Kafaja Hridroga. Gaurava, Aruchi, all those lakshanas are okay, but a clear specific lakshana Vagbhata says is Bharikam Sashma Garbhavat. This one, okay. Bharikam Sashma Garbhavat, like a very big stone he is holding here. Such a pain, such a feeling, the patient comes. I have treated some of the Kafaja Hridroga cases. Patient virtually comes and tells in front of us, sir, there is a big stone over here, please help me to remove it. You can't see the big stone, but that heaviness feeling due to the complete avarodha, complete block of the channels by which he is suffering from Kafaja Hridroga, we can understand. Sannipataja, all the symptoms will be there. Krimija, also there is a clear symptom clear lakshana explained by Vagbhata. Krakache naiva dharyate. Krakache naiva, we say in Kannada gargasa, like cutting pain like this, that pain. The krimis are eating out the hard parts, that causes krakache iva pain. So all the lakshanas are clearly explained by Vagbhata, Sushruta and Charaka. Their angle is different, their approach is different, their line of treatment is also different. I will not go through the detail of it, it will take more time. I am dealing mainly with what Vagbhata is dealing here. So coronary artery occlusion leading to ischemic heart disease can be considered under, that's why Sroto Dushti Janya Hridroga Vikara. See, any disease, any person is suffering from, you have to see 4 entities. One is dosha, second one is dushya involved in it, third one is agni involved in it, fourth one is srotas involved in it. There might be complication in anything, all the 4 may be involved, sometimes 1 or 2 may be involved, that we have to understand. Sometimes, for example, in valvular defects or such things, dosha dushya samurchana is there, sroto dushti is secondary there. Whereas in coronary artery disease is concerned, sroto dushti is the main thing which we observe here. Visheshata, there is atipravritti, sangha and siragranthi is observed in the sroto dushti karana in the coronary artery occlusion. So present paper, it deals with the management of Hridroga, that is coronary artery diseases. Nidana. Nidana is understood as in Hridroga Nidana, Gulma Nidana, Rajekshma Nidana, and as you know, Rasavaha and Pranavaha Sroto Dushti. Because it is a Mula of Rasavaha and Pranavaha, Rasava Sroto Dushti Karana may be there in the patient. Guru Shita Matisnigdham Atimatram Samashnatam Rasavahini Dushyanti Chintyanancha Atichintanam. Stress is the major factor here by which Rasadushti can be done, due to which Sroto Mula can get involved and there may be Hridroga. Another thing is Pranava Sroto Dushti, Kshayat Sandharanat Raukshyat Vyayamat Kyudhitasya cha Pranavahini Dushyanti Srotamsi Anyaischa Darunaihi. Any other disease, when it becomes severe, at the end Hridaya gets involved into it. There will be complications. So any person dying with any other disease ultimately dies due to stoppage of heart, that's due to Pranava Sroto Dushti, Pranava Sroto Vikara, by which Hridaya can stop beating. And the 2 Nidanas, Gulma Nidana and Rajekshma Nidana. What is Rajekshma Nidana? Rajekshma says, Sahasam Vega Samrodaha, Shukrauja Sneha Sankshayaha, then Vishamashanascha. These are the 4 things. That means when you try to do any work above your energy, your capacity, your limitation, say for 3 nights continuously you wake up and do work because of some urgency, that may lead to Rajekshma Samprapti. And Vyayamat Kyudhitasya cha. I will explain a case afterwards about this case in which Pranava Sroto Dushti, how it can be formed in the patient. So Rajekshma Nidana is due to Vata Pradhana Tridosha Prakopa again here, Rasadushti is again involved here, but the Tridosha Prakopa is so much, and Mandagni, Sopalepahi, Kafolbanahi, Vagbhata says, is so much that the organ gets involved, organ gets degenerated very much and it's difficult to cure. Whereas the most of the diseases which are termed as CAD and are taken for surgery, most of them are not due to Pranava Srota Dushti, as I have experienced. They are all due to Gulma Samprapti. Gulma Samprapti, just after taking food you go for Vyayama. Just after taking food you go for Snana, bath. You just take food and go on talking. You do some exercise after that. So Karshitasya Vatalani Atti, already he has become weak. Again Vatakara Ahara he takes. He has taken some food, does the Vyayama, Langhanam Plavanadikam, Vagbhata says. So by these things, the combination of Ahara and Vihara, which will lead to Gulma Samprapti. Dosha Sanchaya is there already in the stomach. By doing these types of things, sometimes nowadays the added Karana has come. After taking food, sometimes if you go for some pranayama prakriya like Kapal Bhati, that also goes to Hridaya. it can lead to Gulma Samprapti. So by which either due to Gulma Samprapti or due to the Rajekshma Samprapti, there can be manifestation of Hridroga, especially Srotodushti Karana Janya Hridroga, that is termed as coronary artery disease by modern people. Now, we will consider Nidana 1 and Samprapti 1, Nidana 2 and Samprapti 2, how the disease Samprapti is observed clinically. Ati Vyayama, Ati Vak, Shuddhitasya Vyayama, Kshayat, Raukshyat, Ati Raukshyat. There is an important point. Modern science says by increased cholesterol there are heart diseases, there are heart blocks. But the truth is that by avoiding sneha you can get Hridroga. Raukshyat, Vegaghata Raukshyat, Charaka also says, Sushruta also says. Ati Raukshyat, Ati Ushna Nidanat. Sneha, if you don't take sneha at all and do continuously Vyayama, the Sankochana of Srotodushti, the degeneration will be there. As a Sanganga Bhanga Sankocha, Sanga, Saushirya Shosha Stambhana, the Vata Prakopa Nidan, Vata Prakopa Parinama, the karma can be observed by doing that. That's why recent study says, for your information, some of you must have already known, recent studies said the cholesterol, the bombarding all the 20 years about the cholesterol by the modern doctors, now it has been proved to be a great lie. They say cholesterol a great lie. Paper has been already published in the internet if you go there. He says, as you have avoided sneha, he has treated about a doctor from America who has treated more than 500 open heart surgeries. He says, in my observation, there was no Hridroga due to increase of cholesterol, he says, because you have not taken snehana, the pathways have been dried out. So by any irritating food when you take, that may cause inflammation immediately, that leads to an obstructive pathology. That is the main route for coronary artery diseases, he says. If the sneha is properly taken, he says, the previous days, the food items which you are taking regularly, sneha is properly taken, the srotas would have been very smoother, very easy flow. There was no cause of any irritation and obstruction due to that. That's why Sushruta and Charaka clearly says Ruksha Nidana is the main cause for the causation of Hridroga, he says. Raukshyat, Chinta, Bhayat, Vega Sandharana, that I have already explained. Vishamashanat, untimely food intake. Sometimes I have seen the patients who are suffering from Hridroga. The main reason which I have observed in their life is, in North Karnataka area, people who take 10 to 12 times tea. Every half an hour they go and take a tea. Such type of habits are there, which will lead to Rukshana of the entire Srotomarga and Agni Mandya. And then whatever ahara they take, Agni will not be there. There will be Ama formation, Ruksha Sharira, that will directly lead to Gulma Samprapti, that we have seen in number of cases. So, and also Vishamashanat, Ati Maithunat. Ati Maithuna is Vata Prakopa. In the second Nidana 2 group, Guru Shita Mati Snigdham, that is already described. Behavioral factors here, Atyashanam, Adhyashanam, Vegadharanam, Ati Vyayamam. The combination of Ahara Vihara, exercise after food, food intake when no appetite is there, sudden change from hot to cold, that is one of the reasons for Gulma Samprapti. You come from outside after a hot sun, after moving in the hot sun, you take fridge water. Many people, we are nowadays accustomed to food which are kept in the fridge. In one of the families who are suffering from, all the family people are suffering from obstructive disorders, Sunday they prepare the food, all the 6 days they eat, keeping it in the fridge. We don't prepare food every day, sir, they say. And all of them are taking number of medicines regularly in their life. So, that's a very bad thing which leads to obstructive pathology, Avarodha Samprapti. So, Ratri Jagarana is also wrong. So, in Samprapti 1, as in Shosha Samprapti, there is Dosha Sanchaya, which leads to Prasara to Sira Dhamani Srotas